on Health Affair, your program of choice, we'll be focusing on some neglected tropical diseases. We'll begin with tuberculosis. I remain your regular anchor, Ushuomo Wadanes, and you're welcome. For a reminder, Health Affair is a platform where we focus on public health challenges, issues about women and children, with the sole aim of providing lasting solutions. Let's take you through our new segment for a start. Some critical stakeholders in the nation's health sector have called for a focus on universal health care, continuous training of medical personnel to replace those who are leaving the system for greener pasture. Speaking during a pre-conference briefing to mark the 2020 August event at the St. Nicholas Hospital in Lagos, Monday, 22nd of August 2022, the experts noted that the issue of brain drain is a global challenge that has been on for some years.
Yes, the healthcare system now is challenged, but we've had challenges in the past. If you recall, about 20, 30 years ago, many people left at that time, very many to the Middle East. But what was done is to make sure that we have the capacity to be able to fill those vacancies. We establish the quality of training that those individuals we produce is of good and international standard. If the products of our healthcare education system, either as nurses or doctors or pharmacists, was not good, the UK and the US and the Middle East, Saudi Arabia will not come to look for them. Granted, it becomes a challenge because then we don't have enough to ensure that we are able to sustain the appropriate numbers to cope. But this is a global problem. Even the UK that Nigerians are running to, the reason why they're mopping up Nigeria is that their own people too are running out and going to other places. So it's a global problem which we hope will stem. But what we as a country should do is to make sure that we continue to sustain the standards. We continue to make sure we provide the enabling environment for doctors, nurses, pharmacists, lab scientists to work.
We have taken the spirit of compromising into every sector of the economy, including the health sector. We compromise on our health, the health practices. We compromise even on the processes. So therefore you could have problems that people say, you know what, that's it, I've had enough, and people leave the country.
The way things are in the country makes it difficult for people to keep giving good health care. Things are expensive. We don't make anything. We don't make virtually everything that involves in giving health care has to be imported. And so that pushes the cost up. And that makes it, for the person providing the health care, you have to source those items at the price they're at. Therefore, the price you now give it to the consumer also goes up. And because we don't have that much money, they can't afford to access to services. So I think what has brought us here is just the way things are in Nigeria. High costs.
This discussion on current health challenges readily brought to mind the exploits done by Dr. Moses Kodumi during his lifetime to provide a lasting solution, a legacy for which is being celebrated biannually by the management of St. Nicholas Hospital and the Moses Adekoyejo Kodumi Foundation as the August event.
Kodumi, as you know, was the first ever Minister of Health of this country. He, at that time, before he was one of the first ever qualified pediatricians. Many people never knew he was a pediatrician. And then later, gynecologists. And he established Island Maternity, Mercy Street Children's Hospital. He also established the Lagos University Medical School, amongst so many other things that he did. And whilst he was the minister, he wrote a paper which looked at healthcare in Nigeria. He analyzed what he thought were the challenges that existed and actually projected as to what he felt should be done to make sure that we improved and continued to sustain good quality. Now that paper, very interestingly, if it is applied to Nigeria today, would clearly celebrate the knowledge and intelligence of that great man. Because he looked at universal healthcare, which is the focus of healthcare now. Many of the things that are now contained in the Millennium Development Goals are things that were contained in his treatise at that time on how to improve the healthcare of Nigeria. He recognized that primary healthcare was important, and he established well over 7 primary healthcare centers in Lagos at that time. He recognized the need for secondary healthcare and tertiary healthcare, and that's why he insisted on developing the Lagos University Medical School. So LUTH and College of Medicine, University of Lagos are some of the legacies of this great man that we're honoring and celebrating.
We've worked in the education sector in Ogun State, whereby we have been able to support through medical scholarship, children who we've provided scholarship for them in their school fees, for their not just school fees alone, even their books, even the instrument that they need. As somebody wanting to be a doctor, dentist, we support even the people. Some of them have graduated, are now doctors.
The 2022 edition of the event slated to hold on the 24th of August at the Musa Center.
Women have been challenged to use their gifts and talents to better humanity by being proactive in the face of emerging opportunities and many unexplored domains. This message is coming from speakers at the just concluded annual general meeting of the Association of Resident Doctors at the Lagos University Teaching Hospital, LUTH, and the 2022 Annual Scientific Conference with the theme, The Role of Women in Leadership, Breaking the Glass Ceiling, and sub-theme, The Doctors, Striking the Delicate Work-Life Balance.
We know that some barriers exist, from social to cultural to religious to political barriers, basically that prevent women from getting to their peak. So this OGM is basically to talk about those issues and look for ways to eliminate those barriers and make our women to get to the peak in leadership position.
The quality of education, the quality of enhancement, quality of leadership, quality of participation, quality of influence must be generalized, not women or men. So there must be proper gender equality and equity in the scheme of things going forward in this nation. And their mental health is very, very key, because work balance is very important. As we work hard in Nigeria, there must be a place for mental health balance. It helps us improve our productivity.
This conversation, if you don't use what you have, intelligent people who can do the work, who can bring innovation, who can bring a faster pace to governance, to medical care, to knowledge acquisition, then we are wasting human capital. What I would like to tell every woman is that you have just one life to live. If you waste it, you would account for it when you get to heaven or wherever you're going. Because all your talents and giftings is to help the humanity as a whole. So why are we just sitting back? Why are we idle and lazy, and we are not proactive enough emotionally, academically to excel, to do even much more? I'm saying to every woman out there today, I love you and I want you to shatter this glass ceiling. Just shatter it once and for all. Let everything become a level playing ground, and we are dealing on merits.
Apparently we don't have any glass ceiling at the Lagos University Teaching Hospital, and I gave all the data that we have, that we are proud of our women. We are not giving them responsibility because they are women. We are giving them responsibility because they deserve it, because they have the skill, they have the knowledge, they are trained to lead. So it is just for us, for our women here, I don't know of other places, they continue to do what they know how to do best.
They have to make efforts on their own to achieve success in their various endeavors of life. If they do not, a man is not likely to want to bring up a woman, but the woman should aspire to break the ceiling, and as we heard today, to shatter the ceiling to achieve greater heights.
The keynote speaker, Dr. Shiju Iluyomade, used the occasion to caution against the rising cases of domestic violence, describing it as an act of barbarism.
Sometimes you can die from physical violence, you can die from emotional abuse, you can die from just stresses in your home or in your marriage or in your workplace. So what I'm saying to every woman is that you have the power in your hand to be who you are destined to be. The law backs you up. Legislation backs you up. Nobody is meant to harm you or to kill you. Domestic violence is a no-no. You say no to domestic violence. Nobody has a right to inflict bodily harm on anybody. Emotional harm is also a no-no.
All work and no play, people often say, makes Jack a dull boy. Monday, the 15th of August, 2022, for the management of the Lagos University Teaching Hospital, LUT, was a time to have fun and exercise to keep fit. The event started with an awareness walk around the neighboring community, Idiaraba. After the walk, they proceeded with the football game and other sporting activities.
No play shots. Pass, just a pass.
We need to be healthy if we are going to take care of people. So, and our staff are encouraged. You can see that since the beginning of this program, you see many of our students, they are here. You see young and old. You saw that I just play the table tennis with my deputy CMAC clinical services. So it is important that we keep fit.
We all know that when we exercise, blood circulates very well around the body, the brain, and of course, it gives you a sense of well-being. And for my students, I'm in charge of sports. I'm the sports coordinator in my school. And I always tell them that when they do exercise, they are better off, when they read, when they study.
And I really enjoy this particular sport activity because it kind of creates a kind of social connection and make everybody relax and after the tension, relax and have fun. So I'm expecting the best and I'm really happy I'm part of this program. Happy Note at 60.
The 60th celebration of the foremost Federal Teaching Hospital started in the month of August to end in October.
Malaria parasite is being transmitted by mosquitoes, and when they get on our skin, they get to bite us and then transmit the Plasmodium falciparum into our body system. And symptoms of malaria can range from fever, headache. Sometimes we have some sores on our mouth.
Beyond the spread of malaria parasite, mosquitoes also transmit other diseases like dengue fever, Zika, filariasis, and many others. According to latest World Malaria Report, over 60 million people are affected yearly, with an estimated $1.1 billion lost annually. A situation, experts say, can no longer continue.
The mosquito does not have any advantage to humans. And of course, malaria is just one of the diseases that are borne by mosquitoes. And we want to let people know that if you don't have mosquitoes, you don't have malaria. And for us to be able to do that, we're advocating what you call larval source management. What is larval source management is wherever is conducive to the mosquito larva, you try to remove it. So it's not just by the chemical applications that we're going to put. We're sensitizing people on how to make sure that the environment is clean and their drainages are clean.
Emergency to be declared a mosquito. Mosquito is evil, it's dangerous to our health. So we must do every effort, make every effort to make sure they don't survive. If you allow them to survive, then they will kill you. It has killed so many.
We've spent over 687 billion naira on malaria. And by the time 2030, if care is not taken, we'll be spending over 2 trillion naira.
As part of activities to mark the global event, the experts embarked on an awareness work to promote vector control, fumigation of drainage systems, and distribution of mosquito nets to pregnant women in the Surulere area of Lagos.
There are a lot of places that don't even have drainages. So if you don't have drainages, we're going to have a lot of backlog of stagnant water, and that makes the mosquito have a very safe place to thrive. So that's why we're here, and we're trying to sensitize those in this community in Surulere that even though government has given you this canal, it is also our duty to make sure that the canal is not abused by people pouring refuse in that. And also, you can see that the association is carrying out a corporate social responsibility in applying larvicides around here so that this will bring down the scourge around this environment, just to mark the World Mosquito Day today. It's a combination of so many efforts, and of course, you know that in Nigeria you have the National Malaria Elimination Program, which we're also part of, and there's been a lot of advocacy.
So the emphasis today is to let people know that there's a need to kill the mosquito so that you save money in curing malaria. So by clearing your gutters, by doing all that we are doing today, is to create an awareness for the drainages, the old tires, the empty cans you keep, and all that, for you to keep them clean. Because if you're able to starve the mosquito, then you'll be able to prevent malaria, not even to cure this time.
World Mosquito Day is marked 20th of August every year. The theme for the 2022 celebration is Harness Innovation to Reduce Malaria Burden and Save Lives.
We see them on a daily basis, but not all of us knows how to handle them.
Daniel Elu is a socio-medical health worker at the Neuropsychiatric Hospital Yaba in Lagos. He is worried about the increasing number of patients with trauma-related problems visiting their facility. Trauma, as described by medical experts, is one or more events that can affect mental state of a person due to their characteristics, given the unabating spate of killings, kidnappings, and socio-economic challenges. Many Nigerians are getting traumatized. The quest for a lasting solution informed this conference and its theme, Assessing and Understanding Trauma in Clinical Social Work Practice.
Traumatic condition seems to be on the increase, not just in Nigeria, but all over the globe. People are traumatized, resulting from insecurity, negative economic impact. Even the political scene is not helping matter at all. And Nigeria seems to be having its own share of it. So we as professionals have decided to organize this program on trauma to educate not just the populace, but to brush our knowledge on the current issue in trauma and trauma-focused intervention. So the only way people can come out of it is to first of all recognize, okay, I'm drifting into depression. And these are signs of trauma. What do I do? Should I see an expert? And who are the experts that I should see?
Recovery from psychological trauma actually starts with the assessment. As soon as you start the assessment, then the person starts getting well. The moment he starts expressing himself or herself. Okay? So having a good skill in this area will help them in the intervention process.
There's fear all over the place. We find it difficult to move from one place to the other. Night travel has been cancelled. Some airports, you cannot go to them anymore in Nigeria. And some part of the country, people who are there cannot go to their villages anymore. So that is a lot of trauma. There's fear, there's stress, there's disconnection with your people. And this leads to a lot of disturbances in the body. Apart from the fear you feel, the stress, the anxiety, then it can lead to some disturbances like insomnia, unable to sleep, not be able to concentrate properly at work. Government should endeavor to set up a coping mechanism, including training more health workers and trying to retain them in the system to be able to manage those who manifest these symptoms and signs.
Those that have passed through the experience must learn to talk to somebody, reach out to professionals like medical social workers or social workers to share your experience, who are there to find solution on how to overcome these traumatic experiences that they are passing through.
One of the things we want people to understand is that you yourself may not know you are undergoing trauma, but if you come into a hospital, if we're able to help you with it, it's not, people have this fear that, oh, they will label you somebody with a mental health problem. No, it's not. We'll just tell you that everybody goes through trauma. Let's refer you to a psychologist, a therapist who's equipped to deal with this and help you through the trauma.
To better utilize medical social workers in Nigeria, speakers at the conference also called for a quick passage of the Social Work Bill.
We ask him to please assent to it. This is the second time that we'll be getting to his table. The other time he did not assent to it. We need his assent so that we'll be encouraged, because we need that legal framework to operate in Nigeria.
Another issue brought to the fore is the need for relevant stakeholders to help subsidize the cost of mental health care in Nigeria.
In the face of Nigerians' continued fight against rising cases of cancer in the country, medical experts have converged under the theme Interventional Radiology in Modern Medicine. The idea is to find ways on how to close the care gap in tackling the cancer scourge. Interventional radiology is a medical specialty that performs different minimally invasive procedures using medical imaging guidance such as X-ray, magnetic resonance, or ultrasound. Though this specialty has grown exponentially in recent years across the globe, Nigeria is still lagging behind in its adaptability.
Is that there are only few centers that are running interventional radiology, just 19 in the country. In a country that has about 201 million people. That is inadequate.
You are talking of CT scanners, you are talking of MRI, you are talking of fluoroscopy, particularly the catheters, all the guide wires and all these ones they are going to use in getting to the organs of interest. They are not readily available here. So we have had to be improvising.
8 out of 10 of our women have breast cancer. And the type of breast cancer that we have are very aggressive and they present late. And majority of our patients are poor. So government should ensure that mammography machine is made available in all our general hospitals so that women can be screened, because the key to management of breast cancer is early detection.
Usually interventional procedures do not require a long stay in the hospital. It's short stay. Some even stay for just a few hours of observation and leave the hospital. But in advanced cases where cancers are involved, where cancers have gone some other places in the body, you might need to stay longer. But the essence of interventional radiology is to reduce the time and to adequately treat the patient.
Beyond the treatment of cancer, interventional radiology is beneficial in the treatment of fibroid.
And that is a tumor, but it's a benign tumor. Now, we can go in through interventional radiology to cut off the blood supply to that tumor, and it will help it to shrink.
To address the challenges associated with brain drain in the nation's health sector, the experts insist on improved budgetary allocation and having the right personnel man their specific areas of specialization. Since the re-emergence of monkeypox in Nigeria, the Nigerian Center for Disease Control, NCDC, has reported 172 cases with 4 deaths across 8 states, namely Lagos, Edo, Imo, Cross River, Rivers, Ondo, Delta, Akwa Ibom State, and the Federal Capital Territory, FCT.
We see diseases, how do they break out? What are the factors promoting it? We have to strengthen that. How can we diagnose? And diagnosis is very vital. You cannot say disease A is caused by organism B if you cannot diagnose it, if you cannot show proof of evidence. And that is where the laboratory comes in readily. So we need to also strengthen the laboratory component of it. At the local government level, we have to strengthen the laboratory component. We have to strengthen the infrastructures there. We have to strengthen the personnel that are going to work there. We are going to strengthen laboratory networking. If you don't have capacity to detect this in your own lab, how do you network with your colleagues at a higher level? If at the state level you cannot do it, how do you network with research institutes like NIMA here or like other research institutes?
All medical laboratories must produce results that are of high quality, that can stand the test of time. When you give a quality result, it will go a long way in saving the patient so that the patient can be given the appropriate treatment and the patient can recover within a very short time. And so if you do that, the patients will benefit from the services. But if the result is not of quality, which means that you are given a false result, and that can actually lead to the death of the patient.
These medical experts want the federal government and other relevant stakeholders to build on the lessons of COVID-19 pandemic to combat new diseases.
Have learned in this really should help us to prepare for an unknown epidemic, because epidemics will continue to occur, and it's our own duty to ensure that we are well prepared.
The common symptoms associated with monkeypox are fever, headache, fatigue, and muscular aches. Human-to-human transmission of the disease can result from close contact with respiratory secretion or skin lesions of an infected person.
Oga Panel Bita, na kawo mota ta ne a tayar da duk wata komada a jikinta.
Ni da yara na za mu kera miki motar nan.
Amma wannan tarin naka, wannan mataki ka ɗauka a kansa.
Oga baya son ya je asibiti don wai kar a ce da shi yana da cutar corona.
Tari alama ce ta cututtuka da dama, har da tarin fuka. Ta hanyar yin gwaji ne kawai za a iya bambancewa.
Na fi sati biyu ina fama da tari.
Ba wani abun tsoro a ciki. Ni kaina na yi gwajin tarin a baya. Domin magance wannan tarin naka, lalle ka je a maka gwaji.
Gaskiya oga ka je a duba ka.
Domin wanda bai je ba zai sani ba.
A bincike tarin nan dan ai maganinsa.
A bincike shi fa domin mu tabbatar.
Duk wanda ke tari har sama da sati biyu zai iya zama alamu ne na tarin fuka. Gwajin cutar tarin fuka da kula da mai cutar duka kyauta ne. Ku kira layin kula da cutar tarin fuka ta ƙasa a lamba kamar haka: 33440 domin samun ƙarin bayani akan inda za a yi gwajin. Wannan saƙo ne daga ma'aikatar kula da lafiya ta ƙasa da tallafin mutanen Amurka. Welcome back. Nigeria ranks 6th among the first 30 countries with high burden of tuberculosis globally and first in Africa. Despite this high burden, low awareness creation on tuberculosis has been identified as one of the major causes of low tuberculosis case finding in the country, the misconceptions and stigmatization. In this special report you're about to watch, we'll take you through the tuberculosis situation in Nigeria, the implications, challenges, and way forward.
Got a call from my team officers in Lagos, in Adamawa, that 10 patients were diagnosed to have extensive resistance TB. Why must we have 10 cases that are having extensive resistance TB?
Shuaibu Al-Hassan is a pharmacist and one of the public health workers at the Federal Ministry of Health, Abuja, handling tuberculosis, leprosy, and brutal ulcer diseases.
he received a call in my presence of about 10 people who were being diagnosed of drug-resistant tuberculosis from Adamawa State. The call got him worried.
When somebody has STI, it means he has defied the use of all the common anti-TB medicines. It's therefore the last point of the TB management. So for 10 patients to be diagnosed at the same time is something that is worrying the program, worrying all the stakeholders of the TB management team. It's not a good one, and we don't want it because SDR is a kind of the ultimate. It's the last point of management of TB. Beyond that, we will not get any drugs that can manage that patient TB. Beyond that, the patient is ultimately, anyway, we have medicine for the management of those cases, but we don't want to reach that level of managing the extreme. We want to manage the cases right from when it's at the onset of the case. When you get to the last stage, that is where it became more dangerous and more difficult to manage. And we don't want to reach that level with any patient at all.
Drug-resistant TB or multi-drug-resistant TB occurs when the bacteria that causes tuberculosis becomes resistant to the drugs being used for treatment, putting the survival of patients at a greater risk. Whether drug-resistant tuberculosis or the regular tuberculosis, the upsurge in cases and unimpressive rating of Nigeria being 6th in the world and 1st in Africa, according to the Director and National Coordinator, National Tuberculosis, Leprosy and Brulee Ulcer Control, Dr. Chukwuma Anyaike, is likened to Nigeria sitting upon a keg of gunpowder waiting to explode.
The data we are having shows that on a yearly basis, we have 444,000 new cases, people being infected newly, not old ones, being infected newly. Now you ask me, where are they? Those ones are in the communities, in the urban slums, in hard-to-reach areas.
Tuberculosis is a potentially serious infectious bacterial disease that mainly affects the lungs, and the bacteria that causes TB are spread when an infected person coughs or sneezes.
It does not respect your age, does not respect your sex, does not respect your social class. Tuberculosis is one of the deadliest bacterial infections. I say this because it disorganizes the system. If you are a breadwinner in your family and you can't go to work, you don't have the strength, of course it has a ripple effect. 2, it can kill you, can collapse your lung, it can even be spread to other parts of the body. That's why we have extrapulmonary tuberculosis. So anything that has to do with your lungs shouldn't be joked with. So it's a highly infectious disease. And we must be very careful in trying to make sure that it does not kill Nigerians. Common symptoms of tuberculosis: weight loss, fever that may not be high grade, weakness of the body, loss of appetite, and cough that has lasted for more than 2 weeks. You go and seek for help. Most of the times, people wake up in the night sweating, even when the environment, the weather is not hot. Weight loss, low-grade fever, cough, and sweating in the night. Of course, to come with other symptoms, depending on the organ, because we have the ones that have gone beyond the lungs. We call them extrapulmonary tuberculosis. So, but these are the classical ones. Once you have it, you go for check.
Tuberculosis is partly preventable by vaccine. The federal government of Nigeria is also offering free tests and treatment for tuberculosis, but not many people are coming out to take advantage of this opportunity.
The government is doing a lot. The tuberculosis The tuberculosis test and the treatment, they're free, including the treatment prevention for those that are in contact with the patient that is being treated for tuberculosis, including people that are HIV positive, and we want to prevent them from coming down with tuberculosis because their immunity is low. The government is providing free medicine for all this. But however, the uptake is not enough. So we need the media to educate the people so that they understand what to do, they know where to access care. And we also have, the government has also put in place a toll-free number, 3340, that people can call and ask questions, ask for direction. So all these things the government has put in place, but our people are not accessing it. In addition, the funding is a problem. We don't have enough. So we need the media to be able to, articulate the issues and help our stakeholders, the key decision maker to understand what the issues are and also provide funding. What you don't know, sometimes it becomes a mystery. And there is this wrong perception that maybe it's God that is punishing them, maybe it's witchcraft, maybe it's some other problem, and they start running helter-skelter. So as the National TB program is talking with the media personnel, they are also talking with religious leaders so that they understand that even when you are prayed for this person, that tell the person to still get medication, go to their facility, do the appropriate testing. So while the person is taking the medication, you can continue praying for the person. That way our people can receive the care they need. Some people, when they start the treatment, they start feeling better. The treatment for tuberculosis is minimum of 6 months. So, but by the time you start taking the treatment for like 2 weeks, 3 weeks, the person start feeling better. So they may start doubting maybe it's not actually TB. But by the time the disease will come back, it will come back in a worse scenario. And in the end, sometimes the family will hide the members of the family that has the disease because they are ashamed. There's nothing to be ashamed of. Tuberculosis is completely curable, but the medication has to be taken for minimum of 6 months. And it is the medical people that will certify that you are cured. So the fact that you feel well does not mean that you are okay. For instance, recently in Lagos, in just a school outreach, a child was discovered to have drug-resistant tuberculosis. He must have caught it from somewhere. But the person that was carrying it was not that ill, was not bedridden. That is why our people are not being sensitive to it. By the time the sickness will now start, it becomes a big deal. They are hospitalized and all that.
The TB anywhere is TB everywhere. TB is in the air. So to say it's not my portion is a wish, and we hope it's not going to be the portion of any one of us. However, we live in the world and we need to be very realistic. So anyone can have TB. But TB is not a death sentence. Number one, it is preventable, it is curable, and the treatment and diagnosis are free. It is very dangerous, very, very dangerous to start TB treatment and not complete it, because it will make the bacteria to mutate and come back in a very strong way, which we call drug resistant. And with drug resistant, the treatment is more expensive, it is more painful, it is longer, and it also has some other side effects. So I will kindly implore those who have TB, please, you can quickly get treated, complete your treatment, and you can be free of TB. And if you already started TB treatment, please make sure you complete it. This is the only way that you can be assured that you have been completely cured.
We realize that stigmatization and discrimination is very much entrenched in the community. Even you see the patient himself stigmatizing herself or himself. Health workers stigmatizing fellow health workers. So it's very strong. And the only way that can be removed is when we let people know that tuberculosis is not a disease caused as a result of any sin. It's because there are so many misconceptions going around in our community. Tuberculosis is like any other disease. If people could own up to have diabetes, if people could own up to be hypertensive, so why don't they own up to say that they have tuberculosis and even seek for help, which we all know that both the diagnosis and the treatment are all free.
Of course, everything has to do with leadership. Aunty, Dr.
Chukuma Ayake came here, little has been said about the fight against TB. So leadership is important, and that is what we are missing in Nigeria. What he's doing now, sensitizing the media, will help people to know about the gravity of what we are facing in this country. According to him, if a child, a pupil in a primary school or nursery school is infected, that child, that pupil has the capacity of infecting another 15. And those 15 has the capacity of infecting more other people. And from the data they've given, we have about 400,000 new cases. So we are in serious trouble, and it is only by reaching out to those who can help, and I believe that the media can help.
There need to be more searchlight on rural communities and hard-to-reach areas, because in most of the rural communities, where a lot of them are not even educated, they don't really know, they don't keep to the trend of what is happening. So a lot of them don't even know that tuberculosis is on the rise. Yes, at times the problem happens with the funding, going to these rural communities and all that. But as a person, if you can do it on your own as a human angle story, even if it's one person, go to the community, talk to a survivor, talk to a patient, let people understand the gravity of what we are dealing with. I think it will help us to even look at more cases.
We need to begin to make people understand the need to begin to, good health-seeking behaviors. I mean, most of us, when we get ill, we either do self-medication, or some of us will either say it's from our village people, so they want to go and see prophet, or they see babalawo and all those kinds of things. Now, those things will only make it worse. So for tuberculosis is endemic. I mean, we are missing a lot of cases in the country, and so it's important that we begin to, all stakeholders need to put all hands on deck. From the Federal Ministry of Health to the partners and everybody, they need to, even at the state level, to the local government level, we need to begin to go to the communities, especially where these things are, begin to get these cases, because until we get these cases, one person, as they say, can infect between 10 to 15 persons in one day. So imagine that we have over 3,000 missing cases. So you can do the calculation.
There's so much the media can do actually for tuberculosis, to help the fight in Nigeria. And from my belief, I believe the media is actually the missing link between all of those undetected cases and the success that needs to be, reached for the TB fight, because there's so much money, there's so much work the doctors are doing, so many implementing partners are on the field and, doing what they have to do. But many more people do not know what, there is for them to benefit from. Tuberculosis is free, but how many people know it, So for me, I think the media has begun a good work so far, and for what the media needs to do is more human angle stories, take your cameras, take your microphones to the real issues, the real places, so that people would understand that this tuberculosis we're talking about is not an ancient disease, not an alien disease for a particular group of people. Like people think, they say tuberculosis is a poor man's disease, but it's not the truth. If a poor man, forgive me, but if you think your driver, for instance, is a poor man, your driver is driving a big man, and he's in the AC car with you, you're prone to it, you're exposed to it, If you think it's your maid is exposed to your children. Your children go to school, they have teachers, they have non-academic staff, who they're exposed to. So it just goes around and comes around, and people really never take it serious, Tuberculosis is really, really the pandemic, much more than COVID, as we think, If you want to put it physically or graphically, they say tuberculosis kills about 157,000 people in a year. That's about 3 air crashes in a year. Do you understand? So imagine that Nigeria had 3 air crashes in a year. You would make that headline news, right? But here it is killing people, and it's not being made headline news because people don't understand the gravity of what it is.
The burden of TB in Nigeria is further being compounded by the COVID-19 pandemic and HIV/AIDS.
You cannot control HIV without TB, you cannot control TB without HIV. And that's still because of the relationship between them. Because someone has HIV and then TB comes up as an opportunistic infection, leads to death. You have not done it, even if you have done everything to cure that HIV or to manage, let's say manage, since HIV cannot cure, you have done everything to manage that HIV. Without paying attention to the TB will come in and eventually lead to the death of that patient. So there is no how HIV can be managed without TB. And TB, on the other hand, someone with TB already, suffering from TB, can still get HIV. So they are both related, one way or the other. So they have to be taken as a syndemic that they are. That is, both of them are related. So they have to be tackled together in order for us to have any reasonable, better health outcome for the clients. The WHO has laid down goals to achieve collaborative activities. So, and it's geared towards, first of all, having a joint platform, coordinating platform. That is, if you want to talk about TB HIV, you should have one single platform, one single body that consists of both HIV, stakeholders in HIV and TB, so that they can do joint planning. Any planning that they have to do for HIV, TB should be carried along. Then we should take steps towards reducing the burden of HIV amongst TB clients in such a way that every TB patient that comes should be tested for HIV, so that if the person is positive, we know on time, we start care on time, and then health outcome is better. Vice versa also for those that have HIV, at every ARC center, at every visit of a HIV client to the ARC center, he should be symptomatically screened for TB, so that if this is present, it's detected early, treatment is instituted early, and then the client can have a better health outcome.
According to a World Health Organization 2017 global report, 18 Nigerians die of tuberculosis every hour, and the country accounts for over 15% of the global gaps in TB case notification. It has been observed that due to low awareness creation on TB, many people in most communities still have misconceptions which have fueled discrimination and stigmatization, thereby preventing people from coming out to test for TB and access free treatment. To change this narrative, stakeholders are calling for all hands to be on deck, especially the media. Just joining us, it's Health Affair on AIT. Please follow us up on the series as we take you through childhood tuberculosis on the next edition of the program. Now let's take you to our nutrition segment, where we'll give you information about fruits and food items and their nutritional value to enable you make healthy choices.
Beetroot is one of the healthiest vegetables. It is the taproot portion of the beet plant, mostly grown for its edible taproots and leaves. Beetroot, also known as blood turnips, apart from being used as food, is a medicinal plant that has been used for ages in the treatment of numerous conditions. Though beetroot comes in different colors, red is more common. They can be eaten raw, as juice, or eaten as salads. The health benefits of this wonderful plant has been widely researched. Beetroot, due to its low sodium, fat, and high folic content, supports mental and emotional well-being. Beetroot, according to experts, may delay signs of premature aging. It can promote skin, liver, and brain health. It is beneficial during pregnancy. It lowers blood pressure, reduces the risk of heart diseases, aids in cancer prevention, helps fight inflammation, reduces bad cholesterol, levels the risk of diabetes.
Follow me to our clinical segment for tips on healthy living.
I know that naturally Nigerians and most of everybody, everywhere now, there's an eatery. Everybody has turned into a chef overnight, but know that monosodium have implications. So we should use them in moderation. Salts and monosodiums should be used in moderations, because when you take them, they exert their activities on your organs, and you can see the rate and speed of kidney failures we have these days.
On how to improve human lives, the nation's health infrastructure, and other sectors of the economy on our perception segment remains a top agenda for us on Health Affairs Desk. So you can participate by calling the numbers showing on your screen.
All be humane in our dealings with people, in everything we do. Today I'm in a position. I should not use that position to oppress and to cause depression to people. Rather, I should use the position as a vantage tool to lift people up and to be kind to humanity. Because what I want people to do to me, that is what I'm expected to do to others. So I should not inflict injuries on human beings. I should be kind and have the milk of humanity flowing in my blood to transmit to others.
Don't forget to support the program by advertising your health products and services with us. My name is Oshuomowa Daniels. Thanks for staying tuned. Please join us same time next week for another interesting edition of the program. Please keep staying safe.